And big story today because we found the first death post-COVID-19 inoculation, which has definitely sparked a lot of fear because there have been cases where people have died after being inoculated with COVID-19 vaccines in Europe. Thailand reported the first COVID-19 vaccine recipient death late yesterday, prompting the Thai public health officials to investigate the cause of the fatality. Vice Minister of Public Health Dr. Sophon Mekton said that the fatality was one of two vaccine recipients who had developed severe side effects, with the disease having suffered from an aortic aneurysm prior to inoculation and the other developing urticaria or hives. An aortic aneurysm is a balloon-like bulge in the aorta, the large artery that carries blood from the heart through the chest and torso. The pressure from blood pumping through it can split the layers of the artery, allowing blood to leak between its layers or burst and disgorge blood into the abdomen. Dr. Sophon said that for a person with an aortic aneurysm, there is a possibility that an artery could rupture at any time, adding that he does not believe his death is related to the COVID-19 vaccine. Dr. Sophon also explained that since a person died after being given a vaccine, it is a standard practice to investigate and identify the exact cause of the death. Meanwhile, Thailand's virologist Dr. Yongpu Warawan said on his Facebook post that aortic aneurysms can be found among elderly people, and they are usually unaware that they have one unless they are examined by experts, adding that a blood vessel with an aneurysm can burst at any time and result in sudden death. But for this specific case, he said that it can be readily assumed that the patient's death was not related to the vaccine. And to really examine aortic aneurysm, there are a few methods. It's either CT scan, chest x-ray, or ultrasound. These are the current ways to examine whether that person has aortic aneurysm.